Mr. Robbins, we may begin when you're ready.
All right, I'd like to call to order the meeting of the Insurance Benefits and Ledge Committee for Wednesday, June 1st, 2022. Carrie?
Okay, this meeting is being conducted virtually, so I will do a roll call of the trustees to confirm attendance. Mr. Knox,
Good morning, I'm here.
Mr. Santos,
Good morning, I'm here.
Ms. Gray,
Good morning.
Mr. Bernstein, Mr. Sanchez, Mr. Moore,
I'm here.
Mr. Kehoe, Ms. Zapanta, Mr. Pryor,
I'm here.
Mr. Harris,
I'm here.
Chair Robbins.
I'm present.
Staff participating in the meeting include CEO Santos Kryman, DCEO Louis Lugo, AEOs JJ Popovich and Laura Guglielmo, Chief Counsel Stephen Rice, Legislative Affairs Officer Barry Liu, from Retiree Healthcare, Cassandra Smith, Director, and Kathy Magida, consultants Stephen Murphy, Richard Ward, Michael Zito, and Stephanie Messier from Siegel. Trustees, please use the Zoom chat option to be placed in queue. At this time, we ask all meeting participants to mute your mics until you are ready to speak, and we may now proceed with the agenda.
Thank you very much. Since Mr. Kehoe is not currently in the meeting, Mr. Santos is the alternate. So Herman, you got the co-pilot's chair, I guess, until Sean shows up. Item number 1A, approval of the meetings of May 5th. I need a motion.
So
I'll
moved.
move. Yeah, second.
Are there any changes to those minutes? Hearing none.
Ms. Gray,
Aye.
Mr. Moore,
Aye.
Mr. Santos,
Yes,
Chair Robbins.
I'm an aye.
The motion passes unanimously.
Thank you very much. Item number 2 is public comment. Do we have anyone from the public wishing to address the committee?
I have no requests.
And neither do I. We're on item 3A, recommendation by Mr. Barry Liu, our Legislative Affairs Officer, that the committee recommend that the Board of Retirement adopt a neutral position on Assembly Bill 2493, which would provide adjustments to retirement payments based on disallowed compensation. And there's a rather lengthy memo dated May 23rd of 2022. Does anyone have any questions about this? If not, I'll accept a motion.
move approval.
I'll second it. Terry?
Ms. Gray,
Aye.
Mr. Moore, Mr. Moore,
Aye.
Mr. Santos,
Yes,
Chair Robbins.
I'm an aye.
The motion passes unanimously.
We're now on to item 4A, the engagement report for May. Mr. Liu.
Thank you. Good morning, Chair Robbins and committee trustees. Some items of interest for you. So as you know, the Cal Savers program has been, rolling along very well. Currently, it applies to employers with at least 5 employees, but there's a pending bill that would make that applicable to employers with at least 1 employee. It wouldn't apply to those who are self-employed, but by changing that eligibility requirement, it certainly would expand coverage as much as possible to those in California who may be working for an employer that does not sponsor a retirement savings program. And then recently, the Department of Labor hosted a roundtable discussion about enhancing retirement security. And so they point out a trend that we are all familiar with, that currently only 16% of private sector workers have pension plans, whereas in contrast, about 86% of public sector workers have a pension plan. And then the other problem is access to pension plans. Currently, there's really, even though there are federal, things that would help people establish these plans. It seems most of the energy is from the state-run savings programs like Cal Savers and programs in Oregon and so forth. One thing that I wasn't aware of was that portability is an issue for those people with 401k plans, because 401k plan sponsors are not required to accept rollovers from another 401k plan. So when you have, generally a trend of people changing jobs frequently, they may have accounts just spread all over the place, which makes it a challenge to consolidate. So certainly portability issues are something that the Labor Secretary want to address. And then in Georgia state, the retirees are getting their first COLA since the Great Recession. I think during this time of high inflation, it's just very interesting to learn about other systems and how they don't necessarily all have COLAs. And if they do, they haven't really been paying them, I guess, consistently. So the Georgia retirees are getting a 1.5% COLA adjustment starting in July. They used to get the same percentage at 3% as Georgia teachers, but one important difference is that the non-teacher plan here never pre-funded their COLA. So that made it an issue in terms of paying it consistently. And then the next item relates to retirement savings participants' decumulation behavior. So for many public employees, they have a pension plan, but they also have a defined contribution plan. So this study looked at their behavior in how they treated their DC plans after retirement. In other words, how soon did they start withdrawing, by what amounts and how often and so forth. So interestingly, in the first 10 years of retirement, only about 48% of participants did not take any partial distributions and 72% did not take any full distributions, whereas about 27% took a partial and then 11% took a full distribution. So it's only in the first 2 years where you see some activity, but in the next 2 to 10 years, people with DC plans tend not to, initiate any activity on it. And then lastly, the other finding was that those who accumulated more funds were less likely to withdraw them upon retirement. So they're just kind of leaving that as a nest egg because presumably they have a pension plan that they're primarily funding their retirement with. And then the last item, interestingly, we generally focus on state and local pension plans, but the federal employees also have a pension plan. Initially, it was a civil service retirement system. In 1987, Congress replaced that with the federal employees retirement system, the FERS plan. And so there's been a debate since then as to who ended up in a better plan. The older plan has a more generous formula, and they also have full cost of living adjustments. On the other hand, the later plan provides Social Security coverage and also a 5% match to the 401k plan. So again, it depends on which plan is better depending on what your situation is. The first plan is generally better for people who don't intend to make a full career in the federal government, whereas the older plan is ideal for people who spend 25 to 40 years in federal service. So that concludes my report. Happy to take any questions.
Thank you very much. Are there any questions for Mr. Liu? Seeing none, we're now on to item B, staff activities report. Cassandra.
Good morning, Mr. Chair, members of the committee. Only one thing to report, and that is that we, over the past weekend, did our annual mailing of the new premium rates for 22-23 to over 56,000 members and survivors who are currently enrolled in the retiree healthcare program. That is it.
Any questions for Cassandra? Seeing none, thank you very much. We'll see what that mailing results in. Item C, claims experience. Stephen Murphy, you're front and center.
Thank you very much. Attaches the experience through the month ending April 2022. First page, again, a summary of enrollment and premiums across the various plans offered by LACERA. Second chart, a larger historical overview of the renewals in past years. The bottom chart gives you a quick reference with regard to the aggregate changes year over year for Anthem, Cigna, and Kaiser. Just as a note, the Kaiser material is a carryover from prior reports. We anticipate an update from Kaiser at the next monthly meeting. Overall, from an Anthem perspective, you're seeing double-digit increases kind of year over year for plans in general and the non-Medicare plans 1 and 2, as well as prudent buyer. And I think what we're seeing is this trend is probably consistent with what other plan sponsors are seeing now as we're kind of coming out of COVID, and we're beginning to see some of that postponed care stepping into the forefront. So we'll continue to monitor that, but LACERA's trends are very consistent with what we're seeing across the board for other plan sponsors. The experience report for Kaiser, again, a holdover from a prior period, but again, just to highlight, the key driver here is 2 large claims that had $1.6 million in excess of the $475,000 pooling points. So again, we'll look forward to the next update to see if that is moderated at all. Next chart is related to large claim activity, just to get a sense of the impact large claims may be having. And as I just noted a moment ago, the impact of large claims on the Kaiser population was significant. Next item is a carryover. It's the pharmacy rebates that are available through the CVS program and Anthem coverage. This is a holdover, and we anticipate an update here as we cycle through the next quarter of the experience. And lastly, the dental and vision claims experience. Again, significant trend increases, but again, consistent with what we're seeing across other plan sponsors as we emerge, hopefully post-pandemic and getting back to more normal routines. Any questions on the experience report?
Are any real red flags that you're seeing, Steve?
At the moment, no. I think we're probably as interested as trustees are in the experience with Kaiser once we get an update. But we usually get that once every 3 months. So once we get that, we'll have a better sense of direction where we're headed. But right now, I wouldn't make much of the Anthem experience to date until we get a little more time under our belts.
I haven't heard much from retirees that are in the Anthem program about delays in getting care and scheduling surgeries and the like, but I have gotten quite a bit of feedback from the Kaiser folks, and Kaiser's apparently, in some instances, pretty backed up on people waiting to get things like orthopedic surgeries and stuff done that they might have put off. So rotator cuffs, knees, hips and knee replacements. I've gotten quite a bit of anecdotal information from the Kaiser folks, and they're not super upset, but Kaiser's apparently getting hammered pretty good in some of those areas right now.
I appreciate you sharing. We'll make sure to bring that up with the Kaiser team and see if they can offer some additional insights.
Anybody have any questions for Steve? Federal legislation, Steve, item D.
Yep, 2 quick items. The public health emergency was extended through mid-July. And as of May 16th, we've passed a self-imposed 60-day deadline for the federal government to notify states if they plan to kind of cease the PHE. So at this point, it's assumed the PHE will go through at least mid-October, if not longer. And that has ramifications because it continues coverage for COVID-19 testing, vaccines, treatment, et cetera, and also expanded telehealth services, particularly for Medicare. So that's something continued worth monitoring. And then I think the other thing of note, adults age 50 and older are eligible to get that second booster shot. So again, I think that's just something to be aware of. And if we can promote that, that would certainly help kind of this population. So beyond that, nothing else to add from the federal level.
Thank you very much. Anyone have any questions for Steve on federal legislation? Seeing nothing, we are now on item 5, items for staff review. Is there any items for staff review?
I have nothing.
Good of the order. I have nothing on good of the order. If anybody has anything, just raise your hand and I'll call on you. Hold it off to the retirement board meeting. Thank you very much. I'll accept an order, motion to adjourn.
So move.
Les, can you bring it back to me real quick?
Sure.
Sorry, I did want to mention, Mr. Bernstein did send a message that he would not be attending, and I wanted it shown in the minutes that he was an excused absence. He's on a plane for this meeting and for the Board of Retirement. Thank you.
And for what it's worth, I talked to Sean Kehoe on Sunday, and he said he had all kinds of meetings and some training and stuff going on today, and he thought he might be intermittently in and out of the meeting. So needless to say, things are a little interesting in his corner of the world right now.
Yeah, I could imagine. Not just him, but hopefully we get a quorum. Let's see.
Yeah. Okay, we have a motion and this meeting is adjourned.